I'm keeping the ports in to protect the skin. And now we're doing some lipo. Okay? Concentrating first underneath the nipple to whittle that down. Are you alright?
Yes, sir.
Good. And this is a curve. I'm sorry, this is a bent cannula. It's a little bit bent. So I can really kind of scoop underneath the gland and get where I want to be and contour and sculpt his chest to perfection. Another local. Yeah, that's good. Don't want to be much higher than that at all. So now I'm going down by the lats. And sculpting this line first. I'm using my smart hand to create space.
We have someone from Arizona. We have someone from...
He's from Miami.
Yeah, someone here said hello from Arizona.
Oh.
How long is the healing process?
Well, you stay in New York, minimum 48 hours. And you're back in the gym in 2 weeks. You have to wear a garment for 6 weeks. But you look great, really, within days. So now here I'm going down to the semilunaris. And really sculpting them nicely. You all right? Good.
You comfortable, my friend?
Yes, sir.
Oh, excellent.
You guys are going to hear Clarence ask the patient every minute on the minute how he's doing. So it's just a routine thing. The patient's great, though.
Father hand. You take care of our people.
Yeah. Good. So I keep on going back and forth. You all right? Using my finger to create lines and spaces.
That's looking nice already.
What will I need to do to not get the indentation I see on some people's chest? I've seen it on some guys who had surgery done by other doctors.
Well, you gotta do it right. If you need lipo, like this guy's skinny, but I'm doing still lipo on him because if I just do gland removal, he'll get that indentation, and that's not good. So you gotta go to the right doctor and do the right operation, basically.
That's a good point. You have to have faith that the doctor you're going to
Right. You have to have faith.
knows what you need.
Right. Gotta have faith in the doctor.
And ask questions. Ask the
Right.
patient. The patient
You
asks.
just see how many people I get. They're 5 weeks out from another doctor and they're calling me up for advice. It's like, really? You know? I'll give you my advice, but not at 5 weeks, at 5 months. At 5 weeks, you're stuck with the doctor you selected. All right?
You're doing great there, brother. Nice.
Antonio, the fat into the chest, that's the cherry on top. You know, Dr. Lebowitz, he goes for that athletic build. So he's never gonna say not to do it. You know, he'll even put a little bit in if there's discussion. But you know, if you're on the fence and you're really against it, you know, talk to Dr. Lebowitz when you guys get to that point. You know, in the end, he wants you to be happy. So that's a discussion that needs to be had. But it's definitely a good idea, 100% a good idea. You know, we've had patients who actually didn't want pectoral lipo filling, and weeks later they regret it. We've had patients come in and say that they wish that they did it. So. You know, we don't make you look like a Ninja Turtle, so that's not an issue. It looks very natural, and everything looks lifted and great.
All right, let me have a stylus. Yeah. There you go. I got it.
Okay.
You gotta fix that. You gotta fix that. Okay. Get past it again.
Yeah.
Alright, so here I am now. Oh, going into the nipple area. Yeah. Be careful, go around on the wall. All right. Yeah, you have to move everything away so we don't contaminate it. You all right? I gave you a lot of local here. You shouldn't feel anything unless I go down below where I'm going. You all right? Good. Good, thank you. You all right? Good. I'm just carving it in.
As you guys see, Dr. Lebowitz is sketching, etching, and sculpting the six-pack. So he's now at the midline, and he's
Yep.
using a bent cannula to really get those shadows and lines.
And I'm also taking my smart hand, and I'm, you right? Good. And I'm deepening the semilunaris, because with guys you want shadows. I'm sorry, guys you want lines and then shadows.
Women want shadows and lines.
Women want shadows first and lines second. Correct. Come on over here. Okay.
Thank you.
Good. It's looking good already.
Some of this footage?
Yeah, I'm posting on the Instagram now. The picture of the lipo.
Got it. So I'm on the opposite side, etching the top of the six-pack, giving some shape.
You guys can see Dr. Lebowitz, his offhand, his left hand is there to really guide the cannula underneath.
Yep. Here I'm underneath the gland. You can see the gland is right there. So I'm freeing it up from all directions. So when it comes time to get the gland out, it'll be smooth and easy. Here I'm etching the pec muscle here.
How can I tell if I actually have gynecomastia and not just fat? I've seen guys who actually...
It's the same.
It's really the same.
It's the same. If you got fat, it's gynecomastia. You just need, liposuction added to.
He's heard that doctors have said to people that just get lipo and that's all that they need, not the gland removal.
Yeah, well, you've seen my videos all the time where I mention you always have to remove the glands.
Dr. Lebowitz does both.
Yeah, but pick the doctor you choose who will do the work that you want. And if you have a problem post-op, make sure that they're receptive to taking care of it.
Talha, it won't. Unfortunately, it won't.
You all right over here? Good.
Looking pretty comfortable.
If you had it
my
for 2
friend.
years, then it's not going away.
It ain't going away.
It will not. Again, it will not. If you've had it for that long, it's gonna be there.
Sorry, buddy.
And you guys will see when the glands come out. You know, that's something you can't, you
Stop
know,
it, fine.
you can't lipo out or anything. You got to get it removed.
What's the matter? Darren, I'm doing the so now I'm doing the horizontal transcriptions on the one side, on the opposite side, and I'll do this when I do to this side. Again, you want lines first, and then you want shadows. Sorry about that. You're doing great.
Yeah, you're doing amazing.
I'm gonna do the bottom one, Darren, now.
Oh, man. Looking good, brother.
You all right?
Yeah.
You're doing good.
Perfect.
So now I'm doing a horizontal inscription down here. Yeah. Yeah, let's go over here. Finish up a little bit over here. You okay?
Yeah.
Doing nicely, man.
You know, people always ask. People always always ask, oh, you know, so much, this and that. Why is it so much? But think about it as an investment for yourself.
That was a little tough.
You know,
Yeah.
going on vacation somewhere in the Bahamas for a week may be great, but when you go home and the tan goes away, you know, that's it. But with this, you know, this is your body. This is what you're gonna have for the rest of your life.
Yeah.
So you got to think of it as an investment on yourself. Much better investment than going away for a week that you may relax and have a good margarita and a pina colada, but once the tan goes away, right? That's it.
Yes, sir. Yeah, the front sight's not bad.
Well, I'm etching them up, so that's fine. But that's only a few minutes. What?
Just the abdomen is right.
No,
Yeah.
no, I'm not doing the abdomen. Not yet.
It's about 6 inches.
With Dr. Lebowitz, it doesn't come back. He, you know, when he goes in there, he takes it all out. So, you know, you can take testosterone after, you can take all that, and it won't come back.
Yeah.
Can I grow muscle if I do the surgery?
Yeah.
Yeah. Dr. Lewis actually injects the fat into the muscle, which acts as stem cells that actually helps build it up when you go back to the gym.
Yeah.
So 2 weeks post-op, you're going back to the gym, you know, it'll give you that motivation to work harder, lift more weights.
So here I am on this side, getting the lats and the space, the negative space between the lats. So my curved cannulas I can head down, bent cannula, and get even down, get some of this waist done. You wanted a little bit of the waist. And I'll do what I can do for the incisions that he allows me to do. He didn't want an incision in his belly button. So we said, okay, no belly button. So let me do what I can do.
Doing great, my friend. Still with us there? You like when you talk? Doing nice, man.
When things open up again, and you can always. Dr. Lebowitz gets patients from all around the world, so. Tala says there's no good surgeons in his country, so.
Yeah. There isn't. Depends where you go, where you live.
There's a few good ones Dr. Lebowitz likes, but you know, there's.
Like they're in Spain and UK and stuff. Okay.
About 800 machines.
Yeah. Lift up a little bit here. You alright? You okay, Kath?
Huh? Okay.
What number's the teeth on the right side? Do you
I'm gonna
remember?
go to a south.
Down there?
Okay?
Way up there, my friend. About 100 to go.
Now you guys see Dr. Lebowitz working on around the nipple area, and that's because and he's feeling the gland, seeing if it's if he's getting it out, so that when he actually goes in there and takes out the gland, it's gonna come out easy.
How you doing there, my friend?
Doing okay.
And that's so great with this technique is that when he goes in there and the incisions are going to be so small and hidden that the healing process is going to look great. You know, you're not going to have any scars in horrible spots like at the ribs, and just it's going to look great. And this patient's going to be thrilled and happy. Garantied.
Answering this again. You all right?
Taha, I'm not sure on your question. How to identify glands? I mean, you'll see when he takes them out, but
Ask him where this guy's from. I know where he's from.
Taha, where are you from? What country are you from?
Just doing the sculpting now.
You all right? Yeah, I'm just sculpting that. It's almost done.
Bangladesh.
Yeah. Don't need an answer.
Getting that midline now.
Alright, he's doing it. There you go.
Almost there.
Not 50.
This one's got good. This one's got more of a thingy.
Mm-hmm.
The right one.
Do you think the right one's bigger?
Did you notice that the left one I whittled down to like nothing?
Yeah.
The right one has some substance. Was that what you thought?
Yes, sir.
Yeah.
Okay.
Yeah.
The right one's the one that I felt like has a tail back into the armpit.
Yes, yes. The left one, not really.
No, sir.
Yeah, the left one I kind of, miraculously lipoed it all out. I'm gonna look in there anyway.
Yeah.
Don't want to, God forbid, you go home and you complain to me, oh, I feel a lump there. And if I say, yeah, I didn't, my bad, I didn't, I didn't go in there. I don't want that to happen to you. No, my bad.
Yeah. Looks good.
Nice. No surprise. Tough down.
He's got to pick on you a little bit, you know.
Nothing like what he's saying. He's doing great, though. Thanks for working.
Yeah, I feel like you were what is it when you play like billiards and you kind of play them? You play the other person, you fake. What is it called?
I don't know what you're saying. Hustling, man.
Hustling. Yeah, he was
Minnesota Pats?
yeah, he was hustling us in the beginning. He was so nervous, but he's
Oh, I understand what you're saying.
you know what I'm saying? He was acting so nervous, but now he's hanging out.
Just chilling now, man.
Nah, that's the thing is, it's a lot. It's very much in a lot of patients' head when they get on the table. They're nervous, but then when they see it, they're like, oh, okay, it's not. Scale 1 to 10, it's a 2, a 3. Getting stung by a bee's worse.
Got your $1,000.
Got it.
It looks great.
You guys can already see the slip and slide right there.
The definition is great. Congratulations, man.
Alright?
Yeah, we're.
Oh, God
I'm gonna.
bless.
What's that?
God bless you. I'm sorry, that part's over.
Well, I may go there a little bit.
You're almost done.
What are you doing? Do a little curved cannulas. Alright, where are we at? 1100?
Just so you get to the left, my friend.
Perfect.
What is it that limited place to be?
What's that?
What is the limited?
Oh, I got the volume I got out of here. 1 liter, 100.
Is that a lot or is that normal?
It's well, it's commensurate to your size and what and how far I'm going down.
That's looking great, partner.
Oh yeah. See, Dr. Lee was trying to get it, but he can't get all of it, you know.
That's why we have to.
That's why you got to go in. But the fact that, you know, people say, "Oh, can I work out and get this out?" And just through working out and losing weight and this and that, you guys are looking at it right now. He's got to go in there eventually and cut it out.
Right. Yeah.
He's doing karate chop method right now. He's giving this guy a nice defined six-pack.
Using that smart hand.
Smart hand's the smartest.
Oh yeah. But you know it's attached to the doctor, though. That's right.
What? Inside a little bit.
We're doing good. I'm trying to get to my side, my friend. Nice, slowly.
All right, guys, we're gonna end this live now, but definitely like the video, subscribe to the channel. We're gonna jump over to Instagram and film the rest of the surgery. We're gonna jump to a curved cannula, so we're gonna etch the six-pack even more in the chest, and we're then gonna take out the glands and perform pectoral lipofilling. So thank you guys for watching. Again, like the video, subscribe to the channel, jump over to Instagram and watch more of our content.